osteoarthritis is the most common type of arthritis in the world. It is a leading cause of disability in elderly, and occurrence of osteoarthritis is on the rise. And that is very obvious because the life expectancy is increasing. The preventable causes of death are getting more prevented, like coronary artery disease. People are surviving longer. So the osteoarthritis is also rising because it is a disease of degeneration. It is a disease of wear and tear, which increases with age. So as the elderly population is increasing, osteoarthritis number is also increasing. So let us get into introduction and then little bit about pathogenesis. The most common joint which gets affected by osteoarthritis is the knee joint. However, hip joint, first metatarsophalangeal joint of the foot, cervical and lumbar spine are the common areas where wear and tear happens and the symptoms of osteoarthritis can occur. In hand, distal interphalangeal joints are the most common site. Distal interphalangeal are one of the common sites, but the most common sites is the base of the thumb or the carpometacarpal joint at the base of the thumb. Usually, wrist, elbow, ankle joints are spared from osteoarthritis. So this is how a person who has osteoarthritis, his hands will appear. So it is very common for elderly people when they have pain and little bit of bony swelling in the distal part, and they come to you saying, we have rheumatoid arthritis, which is you have to judge clinically also, because the site which is affected more by osteoarthritis is the DIP joint, and DIP joint is usually spared in rheumatoid arthritis. So if an elderly patient has bony swelling at the DIP areas, it is most likely a sign of osteoarthritis and not rheumatoid arthritis. In some patients, the PIP joints can also become bony and hard. Now, this is a joint which is common between rheumatoid arthritis and osteoarthritis. But again, a patient who has osteoarthritis will have DIP bony swelling as well as PIP, proximal interphalangeal joint bony swelling also. And these have names. This is Heberden's node and this is called as Bouchard nodes. Heberden node is for the distal interphalangeal joint bony swelling and Bouchard node is for the proximal interphalangeal joint bony swelling. So why it is so important? Because some elderly healthy patients, some elderly healthy people will have rheumatoid factor in low titer in their blood, and they will have hand appearance like this. So we don't have to label them as rheumatoid arthritis. If our suspicion is more towards RA, evaluate completely with anti-CCP, other tests, maybe MRI of the joints to look for synovitis. However, if somebody comes with these kind of hands and rheumatoid factor is low positive, it is not equal to RA. So that is very important. The joint distribution is very important.